Hi, everyone, and welcome back to the next episode of TILLY. I am your host, Marissa Zeppieri-Caruana. A lot of you already know me as Lupus Chick. If this is your first time ever on TILLY, TILLY is actually brought to you by the Lupus Foundation of New England. It is a weekly episodic series, about 30 minutes long, and it airs every Tuesday night at 8 o'clock Eastern. If you follow us on Facebook under the Lupus Foundation of New England or under Lupus Chick, you will see the video libraries. And we have over 60 interviews now of people that are living with lupus, different complementary and alternative therapy practitioners, caregivers, pharmaceutical companies, different new medications, and really anything that you can think of that has to do with chronic illness. So for today's episode, we like to go back every now and then to sort of a foundational video because one of the most common questions that we receive on both platforms is, do I have lupus or do I have an autoimmune disease? I feel like we're hearing this question a lot more ever since COVID, because then I'm going to talk about things that can trigger autoimmune disease or symptoms. And one of those things is infections. So people are noticing whether they got COVID or, after anything that they might have gotten for COVID, that they're noticing these new symptoms that either they never had before or symptoms that maybe they had very sporadically here and there in the past. And now that they're noticing that they have them a lot more. So triggers is going to be one of the things that I talk about today. So for a lot of people that are eventually diagnosed with lupus or an autoimmune disease, even like myself, we are often sick or dealing with symptoms for many years before we actually get a diagnosis. I had very clear symptoms of lupus since I was 8 years old. I'm talking classic symptoms like sun sensitivity, rashes, fever, pain, nose and mouth sores, like things that I think today would sort of make a light bulb go off, for a doctor. Unfortunately, this was back in the early 80s. And even though my mom, took me to the doctor often, we never heard the word lupus. There was never any further testing. So I hear a lot of stories, especially from a lot of the interviews that we've done here on TILLY, for people that had these symptoms and it took them years to get diagnosed. The average right now is between 3 and 6 years. But the great thing with social media and just technology and being able to read other people's stories is I feel like more people are now going to doctors, saying these are the symptoms I have, and I'd like to talk about these potential diseases that it overlaps with or getting tested for these things, right? So I feel like there's a lot more advocating for oneself and sharing just our overall experiences, that are helping people actually get diagnosed somewhat faster. So for a lot of people, when they are noticing, some type of autoimmune activity or lupus, some of the most common symptoms that we hear about are things like fatigue. And this is a sort of crushing fatigue. It's not a fatigue that a nap or a really good night of sleep fixes, and then it sort of goes away. This is a fatigue where you are maybe taking a shower, taking your kids somewhere, making dinner, and you just have to go and sit down, or you need to lay down because you're completely exhausted. And you might sleep for hours, but when you wake up, you don't feel rested. And this can go on and on for days, weeks, and months. So fatigue is often, and obviously fatigue can fit into so many different things, not just lupus. So that's just one thing that people notice. Another is fevers. Low-grade fevers are very common with a large number of people that are diagnosed with lupus. I typically have a fever, I would say probably half of the year, every other day. When I'm in a flare, it is not uncommon for me to have a fever throughout the day, sometimes for weeks. And obviously having a fever, even if you don't have lupus and you're just getting a fever because you have some kind of infection, that it is a very miserable feeling. And, just to do just simple activities of daily living like cooking or laundry or going to work, you just don't feel well. So fevers and fatigues are really common, and also rashes. So we often hear about the butterfly sort of having to do with lupus in a variety of ways. One, it has become, I guess, sort of the logo, or the mascot of lupus, because some people will get what they call a butterfly rash, which starts here on the bridge of the nose and it kind of comes out like a butterfly wings. Sometimes you'll also see the wolf in relation to lupus, and that's sort of in the way that, well, one, lupus is Latin for wolf, but also wolves can be very elusive, right? And hard to catch per se. And getting diagnosed with lupus can also be very elusive and not the easiest thing. It doesn't usually happen right away. So rashes are often seen here on the face. They can also be on the trunk of the body. You might get rashes anywhere though. You might get them in your scalp. And I've noticed for me, when I'm going into a flare up, or if something has triggered the lupus, especially for me, sun and heat are my biggest triggers, I will break out in a rash within a matter of minutes. So rashes are also very common. Another thing that we hear about often are sores, and those are sores that are in the nose, they could be in the mouth, and also on the scalp. And they can be painful for some people, and they can stay there for days or up to weeks. And so this is also another symptom that you want to keep sort of a lookout for. Now, if we go into more organ involvement with lupus, we can look at things like the kidneys. Some people, the reason that they get diagnosed is because they're going to the doctor because maybe they're getting frequent urinary tract infections, and then also they might have something called frothy urine. They might feel like they're urinating a lot. Their urine may not be like a normal urine color. There could be just a variety. They might have kidney pain. So that's sometimes an indicator that lupus is having an issue with the kidneys. And then something else that I should have backtracked, sorry, that's also really common are sort of joint and muscle pain, like an arthritis kind of pain. And also, again, like fatigue, napping and sort of just like staying off your body and just laying down, you don't really get relief. So these are some things that we hear most common. Of course, there are more severe sort of symptoms that some people might present with, and those are things like maybe chest pain, breathing issues. For me, I had a small stroke, and this was because for me, lupus attacks my blood. So that is one of the organs that it can attack. So now I had lupus for quite some time, we need to remember. So it wasn't controlled. I wasn't even diagnosed. So if I had been diagnosed and I had been on medication, perhaps that, would have never happened. But it's really, it depends on the specific person. But overall, you should know lupus can attack your kidneys, your heart, your lungs, your brain, your skin, really. Systemic lupus, there are different types of lupus. Systemic lupus can attack really anywhere, and that means that it's throughout the body. You might hear of something called discoid lupus, and that is specifically on the skin, and only a certain percentage of people diagnosed with discoid lupus will go on to get systemic lupus later on. We hear about other types of lupus, like drug-induced lupus. There are certain drugs out there that for a period of time, they can present very similar symptoms like lupus, but typically when you stop the drug, these will go away. So, but the most often that you will hear about are systemic and discoid. So moving on, let's say that you're having these issues, and again, these can overlap into so many different autoimmune issues. Even some of these, if you tell your doctor you have fatigue, you have fever, you have really bad muscle pain, they might think, you have the flu. They might think maybe I should test you for COVID. It doesn't automatically just ring autoimmune like bells, but it is something to consider if these things are ongoing and you're getting no relief. Also, sun sensitivity, photosensitivity. If you notice When you're out in the sun for a few minutes or the heat and you get a rash, you get extremely tired, maybe you break out in sores or fever, that is also a very classic symptom for lupus. So something that I tell people that is very helpful, especially when you do finally get to see your doctor, journaling or even keeping a note in your phone. It doesn't have to be something long. You might say something like March 3rd, I went out in the sun for 5 minutes and I have this strange rash the next day. I had, let's say, a very emotional few days. Maybe there was a death in the family or something along those lines. And you felt like all of a sudden you had these fevers and you were exhausted. Maybe you had a lot of joint pain. Write all of these things down because these can all be pieces to the puzzle. Like when I was 8, I had such clear symptoms. Like we were going in with rashes, photosensitivity, fevers almost every day, fatigue, and sores. Like I absolutely should have been tested for lupus thinking back. So, you might have had like a rash in your scalp a year ago and maybe an outbreak of sores or fever or a rash during that time, but it went away. So you may not even consider that to be something, but that can be something so significant that can help a doctor say, you know what, I think I want to test you for lupus or for other autoimmune diseases. So journaling and just keeping notes is really important. And then also, you want to have as much information as possible when you do finally get to your doctors. A primary is obviously where most of us will start in this process. If you already have a rheumatologist for any reason, that is a great place to start. So rheumatologist will be most likely your main doctor if you are diagnosed with lupus. But a primary is where most of us start. And I think when you get to a primary appointment, you need to share how you're feeling and be very specific of how these feelings have been ongoing. Maybe they're waxing and waning, which is a term that is very often used in lupus. So lupus has these times of what we call remissions and flares. And remission might be when things get quiet for a little while. And obviously a flare up is sort of when all these symptoms happen, and we talked about earlier in this episode about triggers. And what are triggers? Triggers are different things, and they're different for everyone, that can sort of just be the catalyst to push some symptoms out for autoimmune disease. For me, my triggers are absolutely the sun and the heat, stress, lack of sleep. And when I was younger, right before my menstrual cycle, which is very common for people that have lupus, usually those 3 or 4 days before, their symptoms increase. That fatigue might be crushing, that fever might be a little bit higher, you might break out in rashes or sores. So those are things to also keep in mind. Triggers can also be something emotional, like an emotional stressor, any kind of stressor. It could be a physical stress. Maybe you sort of like pushed your body to the max. Maybe you had an infection. Infections are triggers. Same with pregnancy. A lot of people that I've talked to were diagnosed. If you go back into our video library and listen to Lydia Romero's story, every time she had a child, she was diagnosed with an autoimmune issue. There is, with women, there is definitely a hormone component to it. And sometimes because of that shift in hormones with pregnancy, it can push out symptoms. So those are also things to think about. I always like to remind people stressors can also be great things, but they're still stressful, like moving and maybe taking a new job or getting married, just the whole wedding. Everything can be extremely stressful. So even though we look at it as like it's so exciting and it's a beautiful thing and it's a wonderful thing, it can put enough stress on the body that you start seeing symptoms. So don't always equate stress to a bad thing when it comes to symptoms and how you're feeling in your body. Sometimes we just don't even give any mind to like this amazing and exciting thing that we were doing, but we might have sort of pushed our body to the brink. And that could be why the symptoms came out. Now, when you're at your primary doctor's appointment and you want to discuss, these are the symptoms that I've been having and this is how long it's been going on for, or it's kind of coming for a little while and then it leaves for a little while. When you share with your doctor, you know, that you feel that maybe you should also have some autoimmune testing because it's not going away, or you feel like you have very clear symptoms of, let's say, lupus, you can request, you know, that person to either refer you to a rheumatologist, but even before that referral happens, you can ask for some basic autoimmune disease blood work. Now, there's a couple of different things that I want to share when it comes to getting our blood checked, because a lot of doctors here in the States will sort of use our, you know, typical kind of, I call it archaic laboratory system of, we're going to give you this massive list of tests, and, you know, you're going to go and probably give, say, 10 to 15 tubes of blood, and you may not get a clear answer. You know, you might show signs in some areas, and then other tests might be negative. And so you might hear, well, come back in 6 months from now and we'll take the blood work again. And it could be very frustrating. And I just want you to know, like, this happens. This is unfortunately common when testing for autoimmune disease. But there are different tests. Most typical test is the ANA. And, you know, if you test positive for an ANA, it doesn't mean, yes, you have lupus. A lot of things can make an ANA test positive, but it is one of the main tests they use, along with a lot of other tests and also your symptoms. So for doctors, there is a criteria set for diagnosing lupus, and that is your blood work results, your symptoms, and do you meet a certain number of criteria as far as things that you have to be experiencing? And those are things like photosensitivity, fevers, maybe kidney involvement, anemias, things like that. I believe there's 11, and then you have to fit, you know, I believe 4 or 5 of those, plus your blood work, plus your symptoms, to get an accurate diagnosis of lupus. So it isn't something, it's very rare if you go into a doctor's office and the first time, you know, you get like this absolute diagnosis. I don't know too many cases of that actually happening. So other tests that you might get are complement tests, those C3, C4s, C-reactive proteins, and SED rates. Those are things to measure your inflammation. Also, they might just do a regular blood panel, your CBC, your metabolic, comprehensive panels. Those are things that will test your electrolytes, will test your kidney, your sugars, and things like that. You might have a doctor that goes, you know, a step further and actually tests for any thyroid issues and things like that. So these are all individual blood tests, and you will get answers from these. But some of you here on this channel, you might also be familiar with Exogen, who is one of our sponsors for TILLY. And Exogen makes an incredible test that I've taken multiple times, and I love their test because it's so simple. It's, you know, 1 to 2 tubes of blood, and it doesn't just test for lupus. It tests for a wide variety of autoimmune disease, and has, you know, 99 point something percent accuracy. Like, their test is so accurate, and you can just go to Exogen. It's exagen.com. You can look up something called their AVISE CTD test, which is connective tissue disorders. And it's not, you know, that way you're not being tested just for lupus. There are a lot of autoimmune diseases that have very similar symptoms to lupus that can overlap. So this sort of, you know, helps you get tested for all of them at one time. And you don't have to keep going and giving 12, 13, 14 tubes of blood. So with Exogen, you would call, order a slip, they would send the kit to your doctor, and then you would have the test done. So they can explain that whole process to you. But so there are a couple of different ways that you can go about getting diagnosed with lupus. A primary, like I said, they may just start the initial testing, or they may just refer you to a rheumatologist. And typically with a rheumatologist, because we don't have as many rheumatologists here in the States as we do as primary doctors, there's typically a wait involved. So that's why I'm saying during that time, really start to journal and take note of what symptoms that you're having. That way, when you go there, you can be armed with as much information as possible. Ask your family about symptoms that you may not have even noticed. Maybe someone will tell you that you're experiencing brain fog, you don't remember things. That's something that can happen with lupus. And also ask about your family history. I have a lot of severe rheumatoid arthritis in my family, which is sort of in the same family as lupus. So it was very important for me to understand, like, well, what's the history, my grandparents and sort of going back. So ask about your family history. And yeah, I mean, that's pretty much, the sort of the basic foundation of, do I have lupus? Do I have an autoimmune disease? Those are some of the most common symptoms. And that's sort of a track that you can take to help yourself get diagnosed. You can listen back into some of our older videos of everyone's diagnosis story. It's, everyone's story is just, they're so wildly different. But one thing that we do see over and over again is that it's typically not a really quick diagnosis, because there are a lot of things that have to be ruled out before a physician can tell you, yes, this is lupus. So I hope some of that was helpful. Definitely go to Lupus Foundation of New England or to lupuschick.com, and you can find so much more information on lupus and just a variety of autoimmune and chronic illnesses. And be sure to go back into our video library. And don't forget to come back next Tuesday at 8 o'clock for the next episode of TILLY. If you have any questions, leave them down below in the comments, and I will check them out later on, or you can message us on either platform. And I hope you all have a wonderful night. Take care.